We move to question number 7. Question number 7. What is your position on universal health care? And for this one, we start with Congressman Lampson.
Access to quality and affordable health care is something that should be available to everyone, to all Texans, especially our most vulnerable, our children. We can't get to the issue of talking about quality and affordable health care for all until we discuss providing health care for children, which my opponent opposes. We brought before Congress a bipartisan bill, the S-chip bill. All of you are familiar with it. It did more than just provide for children's health care. It provided for a support for our physicians who provide Medicare to their patients, to our citizens from all around. We passed that bill 2 different times, and it was vetoed by the President both times. In the Senate, it passed unanimously. In the House, we have fallen 9 votes short of the 2/3 necessary to override the President's veto. It means that 500,000 Texas children are not covered by insurance. It means that 50 million people in the United States of America seek the highest cost of care, and you pay for it through increased taxes and higher insurance premiums. Yet my opponent voted against that. A healthy child is a happy child, and one who will be able to study and become a productive citizen. And if they're productive citizens, then we'll be able to spend less into our future. Basic health care, like preventive medicine, shots, and checkups that most children enjoy and should not be a partisan issue. The work that I have done, and again, trying to pull diverse interests together to find common ground solution, has won me the endorsement of the Texas Medical Association.
Mr. Olson, 2 minutes.
Boy, I tell you, it's good to be up here with such an experienced congressman. I am learning many, many things. In fact, I just found out 30 seconds ago that I could actually cast a vote as a Senate staffer. And the congressman artfully dodged the question, what is your position on universal health care? Well, I've got an answer for that position. I am fundamentally against universal health care. It has never worked in the world of the other countries that have done it, and it ultimately results in government bureaucrats rationing out health care. There are other things we can do. In America, we have 300 million, a little over 300 million population, 250 million of whom have adequate health care. So 50 million Americans need some help. There are things we do to help, and we can do it right now. We can pass small business health care plans. This is a concept that allows similarly situated small businesses the opportunity to pool together for insurance purposes so they can lower premiums for their employees and offer them health care. We should also allow the self-employed to deduct 100% of the cost of their health care. Corporations can do it. It makes no sense to me that a self-employed individual can't. And if we do this, we can put a significant dent in the uninsured in America, maybe 20, get it down to 20, 15%. And that's important because when we help small businesses, America grows. 70% of the jobs in our economy are created by small businesses. My opponent supports Barack Obama and his agenda. And as we all know, Barack likes universal health care. He twice voted against the small business health care plans. Twice voted against allowing self-employed to deduct 100% of the cost of their deductible. He's always opposed federal tort reform and medical malpractice reforms that have made a significant difference in bringing down the cost of medicine here in Texas. We have more doctors, and our hospitals are spending less money on administrative costs and focusing on the patients because of tort reform. We need to bring it on a national level, and he's opposed it every step of the way. These aren't the values of the people of the 22nd District, but they're Nick Lampson's, and that's why he can't be trusted to vote our values in D.C.
Congressman Lampson, 1 minute follow-up.
The United States Governors Association, which is Democrat and Republican, opposed associated health plans until some corrections were made to that plan. I will not vote for legislation that is less than the best quality for the people, whether it's the 22nd Congressional District or of this nation. And I did vote for the Patient's Bill of Rights, which was another bipartisan piece of legislation that addressed the legal problems that we face in healthcare, the physician problems that we face in healthcare, and the insurance problems we face in healthcare. Do we want to solve our problems, or do we want to have political fights? We want to solve our problems, ladies and gentlemen. And it doesn't work if we create partisan divide by pushing our issues to the extremes. And there's an opportunity for us to pull back to the middle of the political spectrum and make a difference. The Patients' Bill of Rights was supported widely by healthcare professionals across this country. They didn't like all that was in it. Let's move back to the kind of legislation that is practical, that'll make a difference in all of our lives.